You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, no more CPAP, treating sleep apnea. With us, my first guest says that if you cannot wear a CPAP, you have another option. You have an alternative. Also, if you are a really loud snorer or chronic snoring, you have to hear what he has to say. With us, we have an expert on the topic, one of the busiest centers, if not the busiest in Arizona, Dr. Gary Corr. Dr. Corr, welcome to the program.
Nice to be here, Randy.
Now, we should mention, because look, I have a lot of doctors on my show. Typical sleep apnea doctor might see 3 or new patients a month. I mean, you see 60 to 100 new patients a month coming in for sleep apnea treatment.
Yes, we do.
Are there that many people with this?
They're all over the place.
Really?
There's people that they go to work exhausted, wake up exhausted, can't drive. There are construction workers that can't work or work but not to their best efficiency. There's moms who drive their kids to school and fall asleep at the wheel.
Really?
At stop signs, and yes, there is. It's all over the place.
Is that right? Now, you do a lot of advertising.
Yes, we do.
In Arizona, so people hear about you that way. I saw some of your commercials. So these people think they're sleeping, and I'm paraphrasing, correct me if I'm wrong, but they think they're sleeping, but I guess they're not sleeping.
They're sleeping, but they wake up several times an hour because they can't breathe. See, what happens is when you get into deep sleep, stage 3 and 4 sleep, reparative sleep, when you think you're repairing your body, that's when your tongue goes back, obstructs your airway. And that's when you wake up and you go back to sleep, and you wake up, go back to sleep, and you wake up exhausted at the end of the day. And that happens to a lot of people. So what happens is you wake up, even though you've gotten 6 or 8 hours or 10 hours sleep.
Or you've laid in bed for 8 or 9 hours.
Exactly. But you haven't got enough oxygen, and also you're tired. You're tired because you haven't gotten any restful sleep. You can't stay in deep sleep. So you wake up every day. You wake up, you're tired. You go to work and you fall asleep at work, and you come home. You're tired. You go to sleep early, or you're irritable. You have restless leg syndrome. I mean, just all kinds of stuff. Let me tell you about a gentleman who came to see me. He's 28 years old, who was tired, couldn't hold a job, sleeping all day. His girlfriend said he snored loudly, so we gave him an at-home sleep test. A machine that he takes home, wears it, comes in, we download it and take a look at his results. He stopped breathing 117 times an hour, every hour.
So he's literally waking up 117 times every hour?
Yes.
Interesting.
So he had a job for 3 years. He was tired all the time. His girlfriend says he thought he was lazy. So once we got the diagnosis of severe sleep apnea, we made him a custom-made appliance because his jaw was dropping back. His tongue was obstructing his airway. He couldn't breathe. That's why he was tired all day. So his oxygen level went low. He couldn't sleep, waking up. So he couldn't hold a job at all. So once we made a custom-made appliance that brought his jaw forward, and his tongue came forward with it, he was able to sleep comfortably after that. So he came in after we treated him for sleep apnea, and it was kind of funny because we got him down from 117 down to 9 times an hour, which after that his whole life changed. 3 years after I treated him, he's now a supervisor with 45 people under him. His girlfriend came in, said she thought he was lazy, that's why he didn't hold a job. He says to her, I couldn't stay awake, that's why I couldn't hold a job. So it was amazing results.
Why not a CPAP for him? Isn't that the first line therapy? If you've been diagnosed with sleep apnea,
yes.
Why didn't he do a CPAP?
I tried to get him on CPAP. That's the first order of business. If they're severe, to get him on CPAP. He said, I'm 20 years old, I'm not going to wear a CPAP. And he just refused. So I was either not treat him at all or try to get him the best results we could with an oral appliance. This is not unusual for us to see people who refuse to wear CPAP or can't wear CPAP.
So we should mention insurance. Most of what we're talking about, insurance covers, Medicare even covers it. Is that right?
Medicare does cover it. With supplement, they covered 100%.
Okay.
We're in network with most major medicals. So one of the few dentists that are in network. They only allow a few dentists in the network. In the program, so we're lucky to be in network with most major medicals.
So you do all the medical billing?
Yes,
right
we
there.
have a whole medical staff, staff that does nothing but bills. We have 2 billers in our office, that's how they do. And we have no dental equipment in our office. We have no dental chairs. We're passionate about what we do. We have a great staff that's treat sleep apnea. So they come in and we do the medical billing. We do all the pre insurance work on it. They know exactly what their benefits are and their deductibles. So we do all that work for them.
What's easier to treat? Somebody that's a loud snorer that's disrupting their partner can't sleep because they're loud snoring, or the CPAP patient? I mean, is the loud snorer the easy one to treat with this?
I think everybody's easy to treat.
Okay.
So if you get the right person in the chair, and what we do is we have Easy Boy recliners. I'll set the Easy Boy recliner back so that they're like in bed, and I'll bring the jaw forward and have them snore. If we can get them to stop snoring with this position, I know that we'll be successful.
Knowing you were going to come here today, anticipating it, I've been asking around, and one person in particular, a friend of mine, she says her husband snores terribly. And it's at a point where they're thinking about sleeping in 2 different rooms. Okay, and this is a young couple, 40s. Is this common, where they just kind of live a separate life as far as sleeping wise?
It's very common. In fact, I had a lady that came into me. She says, "Dr. Kaur, I've been newly married, and my husband wants to leave the bedroom. So can you help me?" So we got her. We had her tested. She was severe sleep apnea. She's just mild severe, and so she refused to do CPAP because new husband. So what happened is we got her treated, but finally that not only that she was snoring a lot, her husband didn't want her to drive his kids to school in the morning because she was falling asleep at the stop sign. So the problem really was that he wouldn't let her drive in the morning with the kids.
Okay.
She also was a computer programmer, so she got to her desk, she'd fall asleep half the time. So we got her treated with all appliance, and her husband said she stopped snoring, so he was happy, and her work performance improved. She got 2 raises since we treated her, and she's allowed to drive her kids in the morning to school now. Nice story.
So it can be life-changing for many of these people.
Well, very, very much so. We have people who come in, and I hired a new gal, that one of my billers, her husband Antonio. Last week I saw him the first time since I've given him a sleep appliance 2 weeks ago, and he says that he used to wake up every morning with headaches, and his wife, my biller, says that she stayed awake half the night because she stopped breathing. She gasping for air.
Yeah, because it affects the partner. They can't sleep, and then
affects
they
the
wake up tired too.
Exactly.
Interesting.
They say that sleep apnea wakes up an average of 27 times an hour, where the person sleeping next to sleep apnea wakes up 21 times an hour. So affects the partner very much so. And we've done, I say, social work, because we get people back together, sleeping together. And if it affects the lives,
Social work, you call it.
We call it social work. Yeah. Usually the wife will say, sends the husband in.
Really?
And then the spouse will send the other one in, because now they're snoring. So I saw my medical biller's husband for the first time since I gave the appliance, and he says he's sleeping through the night, not snoring at all, and no headaches. He had headaches every single day of his life since he's CPAP intolerant. He wears it half the time, and half the time he doesn't. His wife says that she gets good night's sleep because she doesn't have to stay awake listening for him to stop breathing.
Are they comfortable? I mean, you're putting this appliances in. Is it comfortable?
They're very comfortable. I wear one myself. 7.5 years I've been diagnosed with sleep apnea. So I know they're comfortable. I know they work because it works for me.
Is that yours right there?
It is.
Would you mind putting it in?
Sure.
I mean, let's take a look. Okay, so this is one custom made for you.
This is custom made for me. I've worn it. This is a 7 years old appliance.
Okay, here we go. There we go.
That's it.
That's it.
So when I wear this, I get a good night's sleep. Can you understand me?
A little bit. We could have you take it out again. But when you wear that, you sleep well.
I do.
If you don't wear it, what happens?
I get cranky, tired, listless, can't concentrate.
We talked about this on the phone. I'm glad you took it out so we could hear you now. But it's almost like you didn't want to take it out. Is it that comfortable?
It is.
It is that comfortable. But we talked about this, that when you don't sleep, and this is universal, right? Because I asked you, is it the same as just not sleeping in general? But if you don't sleep, the next day, you're not in a good mood. Your memory's not so good. Your concentration's not very well.
After a couple of days, my concentration is really poor.
Yeah, your ambition goes down, libido goes down.
Sex drive goes down.
So when you fit them with this custom-made appliance, you stop their snoring, you take care of their sleep apnea, do they report better energy? Do they report like weight loss for those things?
They report a lot of stuff. When we get them back in, we ask them if they've slept through a night, no daytime tiredness, if they snore, that they're dreaming. See, if you don't stay in deep sleep, then you don't dream well.
Oh, really?
There's many people that haven't dreamed in 20 years. It's kind of weird. They say, I start dreaming, but it's kind of weird. It's dreaming again. It's kind of funny.
So you get them dreaming again, and that proves that they're in deep sleep.
Yes, stay in deep sleep. Because they usually get in deep sleep and their tongue goes back, obstruct their airway, so they're out of deep sleep half the night.
Okay. We're going to take a quick break. When we come back, more about the process. What somebody can expect, what kind of diagnostic equipment you're using, and how soon they can expect results. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
Thank you, Dr. Kaur.
Thank you, Dr. Kaur.
Thank you, Dr. Kaur.
Thank you.
Thank you, Dr. Kaur.
Thank you, Dr. Kaur.
I gotta thank you.
Snoring could be a sign of dangerous sleep apnea. Call Dr. Kaur now for a Medicare or major medical covered solution.
Thank you, Dr. Kaur. Life is so much better when I get a good night's sleep.
Thank you, Dr. Kaur, for helping me sleep again and getting my life back to normal.
Change your life today. Call Dr. Kaur now for your free sleep screening.
Thank you for changing my life, for helping me to sleep again and to be a healthier, happier person.
You're watching the Wellness Hour. I'm Randy Alvarez, news that makes you healthier. We're discussing sleep apnea and also chronic snoring. According to my guest, Dr. Kaur, the busiest guy in Arizona, and his practice is focused only on dealing with sleep. Dr. Kaur, welcome back to the program. So this is all you do. And how long has it been since this is all you do?
I've been doing this full-time for the last 5 years. I have 2 practices, one in Chandler, Arizona, and one in Phoenix, Arizona. And we travel back and forth, I've had the same staff for the last 4 or 5 years. They're great. They're a very caring staff. They know what the people are going through, so they're very considerate. So when you come to my office, people are very experienced what they do.
Because people that have no sleep, they're probably edgy. They're probably not the friendliest people when they come in. Sometimes.
Yes, they're edgy, but you have to realize what they're going through. Because if you have sleep apnea, then you wake up, you're tired, you're cranky, you have no energy, and your libido goes down. Everything just doesn't function well. So if you can't sleep, then reparative functions don't process. Also, you lack sex drive, because during deep sleep is when your hormones get replenished during deep sleep. So if you don't stay in deep sleep, your hormones will get replenished, so your sex drive goes down.
For the person that is not just the chronic snorer that you said is easy to treat, easy for you, but for the sleep apnea patient, who normally does the diagnosis?
Diagnosis is always done by a physician.
Okay.
We're the intermediary. We're helping the physician treat sleep apnea. So we treat them, they diagnose it.
So when they treat them and they find out you have sleep apnea, the first line therapy is a CPAP. Is that correct?
That's not true. The American Academy of Sleep Medicine, the physician group that regulates sleep, which I'm a member of, says that mild or moderate sleep apnea is either you have a choice between a CPAP or the oral appliance.
Okay.
If you're severe sleep apnea, you should try the oral appliance. You should try the CPAP first. If you wear the CPAP, fine. If you can't wear it, then you go to an oral appliance. We follow the rules and regulations of American Academy of Sleep Medicine by the T.
Are people surprised that insurance covers this?
It's covered 100% on a Medicare with their supplement. Also, all the insurance companies covered benefit. You cannot say that you can get a CPAP and they'll pay for it, but not an oral appliance. It's like taking an antibiotic. If one doesn't work, you can't have another antibiotic. No, you take another antibiotic until you find an antibiotic that works. So the same thing with sleep. If they can't tolerate CPAP, then they have to be treated with an oral appliance. So that's why it's covered.
I asked you on the phone, and this is what I like. I said, why do you think you get better results than most guys when it comes to sleep apnea? And your response immediately was, because I care. But what does that mean, you care? And why does you caring have anything to do with the outcome?
Well,
Respectfully, I ask.
Well, we care because all we do is sleep. So when you just do sleep, you can spend your time doing sleep. We may see a patient 4, 5, 6 times, 8 times, 10 times until they're properly adjusted. Whereas if you have a busy dental practice, you're kind of squeezing them in between patients. And to see a patient 10 times when you're only getting paid once for the patient appliance is really tough.
So insurance doesn't pay for those subsequent adjustment visits.
No, it's called a global. It's called
Okay.
a global. It's like if you break your leg and you get a cast on it. They don't see. The cast is for 90 days. Your adjustment for 90 days. So we get paid for the appliance. We have to see them for 90 days for no charge, which is fine by me because I want to get the patient treated properly. So we'll see the patient 6 or 8 times until we figure out that they're properly
So these
treated.
trips back and forth to your office, that's to adjust the appliance to make sure they're sleeping.
It's open airway.
How do you know if it's working?
Well, because during the course of time, we see them, we ask them questions, how they're sleeping, if they're sleeping through the night, no daytime tiredness, if they're dreaming, and if they're snoring. So once they stop snoring and they're sleeping through the night, no daytime tiredness, then we give them a sleep test. We want to find out where they're at now in the treatment. So if they're sleeping properly and they get a sleep test with the appliance in place and their numbers come down, then we know they're at a good place. There's one guy who comes in from a sleep doctor who doesn't mind to wear a CPAP, but his level of pressure that has to be pushed through the CPAP is too high for him. So he wants me to give him an appliance and wear a CPAP at the same time. So the guy comes from Rochester, New York, which is close to my hometown in Buffalo. And so he was here, a winter visitor. So his summertime was coming up, so he was going to leave soon. So I figured, okay, we'll give him an oral appliance, try to get his numbers down for his pressure on his CPAP. He comes to see me, and we get him so low that he doesn't have to use a CPAP anymore. So it was kind of a nice story. He goes back to Rochester with low numbers without a CPAP. We got off CPAP, so he's sleeping through the night, and he feels better about himself. He's sleeping next to his wife without having a cord stuck between them. He just changed his whole life, and his wife's too. So I don't try to get them off the CPAP. If they're on the CPAP and they're comfortable, keep on the CPAP. But
Would you say you've had hundreds of people, and look, you made it crystal clear to me. You say, look, the medical doctors in my town are doing a great job. They send me patients. You work with these medical doctors with CPAP. You said CPAP works, but some people can't wear it at all, right?
Right.
They just can't wear it. So for those particular people that are watching this, maybe they've tried appliance therapy and they say it didn't work. What do you say to those people?
Well, I'm not sure what appliances they use. There's 57 appliances have been approved by the FDA. A lot of appliances I wouldn't put in my mouth. I know the appliance that we use in my hands works good. But, you need to go to a sleep specialist, a sleep dentist, who does nothing but sleep, because that's all we do. We know how to get around some of the obstacles that the general practitioner doesn't know how to
We're going to take a quick break. We come back. More about the frequently asked questions. So when people come in, either they're loud snorers or they're on a CPAP that they cannot wear, I want to know what they're asking you and give us the answers here. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Because of his sleep apnea, I was constantly kicking him, nudging him to get him to stop his snoring.
Snoring could be a sign of dangerous sleep apnea. Call Dr. Core now for a Medicare or major medical covered solution.
Couldn't get a good night's rest. I would want to nod off when I was driving. Couldn't keep my eyes open.
Change your life today. Call Dr. Core now for your free sleep screening.
I get a good night's rest. I wake up good in the morning. I feel refreshed.
And he's not snoring.
And that makes her really happy.
Thank you, Dr. Core, for allowing me to get a good night's rest by helping my husband with the sleep appliance.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, sleep apnea and chronic snoring. According to my first guest, he sees reversals every single day in his office, Dr. Gary Core. Is that right?
Yes, we do.
So every day you see people that were chronic snoring, people that were sleeping in another room, aside from their partner because of their loud snoring, and all that's reversed. Happens all the time.
Every day. I get hugs from people every single day of the week. It's kind of nice. I've been doing dentistry for 34 years, and in 34 years I've never gotten so many hugs from people who said thank you. It just changes their life when they can sleep through the night next to their partner and wake up refreshed and breathing.
What about somebody comes into you, right? They have a CPAP, but they have dental problems, or maybe they're wearing a denture. What about these people? Are they trickier? Are they tougher to deal with?
Actually,
Like what if you have really weak teeth? Can you do that with this?
as long as we have 6 teeth on the bottom, 6 teeth on top, we could do it. Or if they have a denture, easiest impressions is take the denture out, do the impressions out of their mouth, take the bite in the mouth. So dentures are easy.
Are there a lot of people wearing dentures that have sleep apnea?
Yes, they do, because what happens is the denture obstructs your airway a little bit because it takes room from your tongue. So the plastic flanges and the dentures take your space from where your tongue should be. So that, yes. And also the worn dentures where they're collapsed and their tongue has no place to go except back. So opening their mouth and bringing their jaw forward helps them incredibly.
So take me through the process. If somebody comes in, either they're a really loud snorer or they can't wear their CPAP. Maybe they already have a diagnosis. What's it like on day one? How soon do you give them a treatment plan where they can take advantage of the appliance therapy?
If they've been on CPAP, then that means they're already diagnosed.
Okay.
That's the easy patient. We do a CT scan. We want to look at their airway, we want to look at their tongue position, we want to look at their jaws, their sinus.
Do they meet with you or your team?
They meet with me and my team
Okay.
first day, both of us. So my team takes them back and goes through a lot of questions about snoring and headaches, that kind of stuff. Then I get that assessment. We do a CT scan. I look at the CT scan and look at their airway. We want to find out how they're breathing. You know, what's obstructing, where's their tongue position, their sinus, their jaw joints. Before we do anything, we sit down with them and I interview them. I give them a head neck exam, full head neck exam, where I look at the airways, I look at their tonsils, their tongue position, their musculature, if they have any TMJ problems, how many teeth they have. So we do a full head neck exam. Then we do an assessment. We find out if they have a CPAP or not. So we send them home with a sophisticated sleep test. We have 9 of them in the office. They measure oxygen level, your pulse. It's not like a watch where it's Fitbit, where it just tells you about sleep.
Like how many times you're moving.
Exactly. This is a sophisticated sleep test that you wear while you're sleeping. It's a computer.
Okay.
And that measures your airway, your oxygen level, your pulse, your heart rate. And we're looking at how many times an hour they stop breathing, or they stop breathing all night, and their oxygen level during that same time. So when they get a sophisticated test, they take it home, they wear it at night. Sometimes a 2-night test, and bring it back, and we take a look at what their numbers are. We sit down with them, we go
So
over
what
them.
are these numbers? What do they mean?
The main number I look at is their their index. Find out if they are sleep apneic, how many times they stop breathing an hour.
What's common, like for your typical patient, how many times they wake up in 1 hour?
Well, it depends. I mean, we have people that are slight or mild sleep apneics from 5 to 15 times an hour to severe. We have people 130 times an hour they stop breathing.
Wow.
And everything in between. We treated airplane pilots, Air Force pilots, police officers, and everybody in between. Channel nighttime newscaster, actually 2, one in Spanish TV and one in regular TV.
So these are people that couldn't sleep. That means they had sleep apnea. They're tired all the time. You make a custom-made appliance. I'm trying not to put words in your mouth, but you make a custom-made appliance. And like these newscasters, things like that, police officers, it's reversed.
Yes.
And now they have more energy. They're sleeping again.
One lady came from Miami. She was a newscaster at night. Young lady. She was getting married, so she didn't want to wear her CPAP. So she said, "Dr. Kaur, I'm getting engaged. I'm getting married. Can you get me off my CPAP?" It was her decision to get off CPAP. But she was a moderate, so it was easy to do. And so she got married and wearing an oral appliance instead of having a hose between her and her husband. She wakes up refreshed, more energy throughout the day, and she's at nighttime, the newscaster. She has more energy at night before she falls asleep before a newscast at 10 o'clock at night. So it really changed her life and her career too. We had a jet pilot came in from the Air Force Base. Funny. He was diagnosed with sleep apnea, which he couldn't fly his jet. He comes to me, he says, "Dr. Kaur, if you give me an oral appliance, I can get back in my jet. If not, I have to wear a CPAP for 6 months until I get treated for sleep apnea."
Wow.
So he comes to me, and he was moderate. He had 23 times an hour he stopped breathing. So he says, "Please, this what I live for is to fly jets. That's what I'm in." He's a small guy too. So we got him down low number when he stopped breathing, less than 6 times an hour, which is very, very mild sleep apnea. But it wasn't good enough for the Air Force. So he says, we need to get him in below 5 times an hour, stop breathing.
Okay.
So we gave him a second sleep test after we adjusted him for another week, and we got him down below 4 actually times an hour, which meets the criteria for him flying.
Is that right?
And he's now in Colorado flying jets.
People, again, we've said at the beginning of the show, these people that are loud snores or sleep apnea, where they're gasping for air,
Yes.
they breathe fine all day, and at night they lay down, and their jaw and their tongue drop back. And what you're doing with a custom-made appliance is bringing it forward, opening the airway, and they can breathe again. and because they can breathe again, they're sleeping. Is that the simple thing
That's a simple way of putting it, but also they're getting oxygen, which is the most important thing, because the oxygen level is low because their tongue is obstructing your airway. I had a guy last week who stopped breathing for 90 seconds during the test that we gave him. That's not holding your breath, that's your tongue obstructing your airway. It's like putting a sock in your throat.
Wow.
Follow-up was we got him in a sleep appliance, we got him treated, follow-up a few times, and he's now sleeping regularly. He wakes up. He used to have severe headaches because of the oxygen level. No headaches, and he feels great. His life's changed. He goes to work. We're refreshed. Stays up late. I have every day. I hear this. I have one guy who came to see me, an older gentleman. His name is Joe. Joe came to see me because he had a headache every day and he started snoring bad. His wife couldn't stand it anymore, so he came to see me. So Joe said that he couldn't breathe. He was gasping for air in his sleep, and he woke up every day with a headache. So we treated him. After 1 week of treatment, he said he slept through the night. First time, and he can remember that he hasn't had a headache. His grandkids used to call him Grumpy Grandpa, and Grumpy Grandpa didn't like the kids because he was irritable all the time, and changed his life. His wife says, thank you for giving my husband back, and it's incredible. He now gets up, he has no headaches, he's refreshed, he has energy to play with the grandkids now, which he didn't have before. He's not grumpy anymore. He's not Grumpy Grandpa.
Final message. We're out of time. Somebody watching this, maybe they've seen your commercials, they've seen you on your Life A to Z, they know they're allowed to snore, they've been told. Or maybe they have a CPAP in their closet that they don't wear. But for whatever reason, they're skeptical. Maybe because they're tired, they're not motivated to do this. What do you tell them?
I tell them to get tested, get a proper diagnosis. Get a diagnosis first. Find out if you're sleep apneic, because we can help you. We can save your life. Okay. You knock 7 to 15 years off your life if you're undiagnosed, untreated sleep apneic. So we could change your life. We give you energy, stop snoring, and you just feel better all the time. I should mention, we can't help everybody, but we can't help you unless you come in and see if we can help you.
Okay.
This is a medical problem that's severe enough that we take it very serious. This is your life, and if you don't get help, then serious outcomes can happen.
Okay. So if you have a PPO, if you have Medicare, this covers it. It's covered by insurance. Is that right?
Yes, it is. It's medical. It's a medical problem. It's a dental cure for medical problem.
And you're in network, so even if you don't have a PPO, does some of this get covered?
Yes, it does. We're in network with almost every insurance company out there.
I want to thank you for coming on the show. Great information.
Pleasure to be here, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.